Hi friends, how are you all? Welcome back to Agape Vlogs, and I really hope all of you are safe. Do take adequate care in this pandemic season. I would like to thank all of you who have subscribed to Agape Vlogs and those who have recently walked in to Agape Vlogs. Let's move on to question number 21. You are caring for a patient who has had a recent head injury and you have been asked to carry out neurological observations every 15 minutes. You assess and find that his pupils are unequal and one is not reactive to light. You are no longer able to rouse him. What are your actions? Option A. Continue with your neurological assessment. Calculate your Glasgow coma scale and document clearly. Option B. This is a medical emergency. Basic airway breathing and circulation should be attended urgently and senior help should be sought. Option C. Refer to the neurology team. Option D. Break down the patient's Glasgow coma scale as follows. Best verbal response V equal XX. Best motor response M equal XX and eye opening E equal XX. Use this when you hand over. So what is the right option? We have already come upon this question in one of our previous tests. So option B is the right answer. Hope you got it right. For those of you who are visiting Agape Vlogs for the first time, kindly refer to my previous vlogs. I have already done NMC mock test part 1, test 1, 2, 3 and 4. This is continuation of test 4 from questions 20 to 30. Moving on to question number 22. A patient in your care is about to go for a liver biopsy. What are the most likely potential complications related to the procedure? Option A. Inadvertent puncture of the pleura, a blood vessel or bile duct. Option B. Inadvertent puncture of the heart, esophagus or spleen. Option C. Cardiac arrest requiring resuscitation. Option D. Inadvertent puncture of the kidney and cardiac arrest. Option A is the right answer. That is, it is related to liver biopsy and the answer is inadvertent puncture of the pleura, a blood vessel or bile duct. So that's the right answer. Hope you got it right. Question number 23. When should adult patients in acute hospital settings have observations taken? Option A. When they are admitted or initially assessed, a plan should be clearly documented which identifies which observations should be taken and how frequently subsequent observations should be done. Option B. When they are admitted and then once daily unless they deteriorate. Option C. As indicated by the doctor. Option D. Temperature should be taken daily, respirations at night, pulse and blood pressure 4 hourly. Answer is option A, which is when they are admitted or initially assessed, a plan should be clearly documented which identifies which observation should be taken and how frequently subsequent observation should be done. So that is the answer. So guys, let's move on to the 24th question. Why are physiological scoring systems or early warning scoring systems used in clinical practice? Option A. They help the nursing staff to accurately predict patient dependency on a shift-by-shift basis. Option B. The system provides an early accurate predictor of deterioration by identifying physiological criteria that alert the nursing staff to a patient at risk. Option C. These scoring systems are carried out as part of a national audit, so we know how sick patients are in the United Kingdom. Option D. They enable nurses to call for assistance from the outreach team or the doctors via an electronic communication system. So, naturally, the right answer is option B. That is, the system provides an early accurate predictor of deterioration by identifying physiological criteria that alert the nursing staff to a patient at risk. Got it? Moving on to question number 25. A patient on your ward complains that her heart is racing and you find that the pulse is too fast to manually palpate. What would your actions be? Option A. Shout for help and run to collect the crash trolley. Option B. Ask the patient to calm down and check her most recent set of bloods and fluid balance. Option C, a full set of observations: blood pressure, respiratory rate, oxygen saturation, and temperature. It is essential to perform a 12-lead ECG. The patient should then be reviewed by the doctor. And option D, check baseline observations and refer to the cardiology team. So your question was that the patient's heart is racing and you find that the pulse is too fast to manually palpate. What would your action be? It is a full set of observations: blood pressure, respiratory rate, oxygen saturation, and temperature. It is essential to perform a 12-lead ECG. The patient should then be reviewed by the doctor. That is, option C is the right answer. Guys, before going to the next question, let me remind you, if you found this vlog useful, please don't forget to give me a thumbs up. Question number 26. If a patient feels a cramping sensation in the abdomen after colonoscopy, it is advisable that they should do or have which of the following? Option A, eat and drink as soon as sedation has worn off. Option B, drink 500 ml of fluid immediately to flush out any gas retained in the abdomen. Option C, have half-hourly blood pressure performed for 12 hours. And option D, be nursed flat and kept in bed for 12 hours. The right answer is option A, that is, eat and drink as soon as sedation has worn off. Question number 27. How do you ensure the correct blood to culture ratio when obtaining a blood culture specimen from an adult patient? Option A, collect at least 10 ml of blood. Option B, collect at least 5 ml of blood. Option C, collect blood until the specimen bottle stops filling. Option D, collect as much blood as the vein will give you. So the right answer is collect at least 10 ml of blood. That is, option A is the right answer. Friends, before going to the last question, if you haven't subscribed, please do subscribe Agape Vlogs and do click the all notifications button so that you get a reminder whenever I make a post. And also, don't forget to give me your valuable feedback whether you found this useful or not. I would certainly love to know it. Question number 28. If blood is being taken for other tests and a patient requires collection of blood cultures, which should come first to reduce the risk of contamination? Option A, inoculate the aerobic culture first. Option B, take the other blood tests first. Option C, inoculate the anaerobic culture first. Option D, the order does not matter as long as the bottles are clean. Option A, that is, inoculate the aerobic culture first, is the right answer. Next, moving on to question number 29. Which of the following would indicate an infection? Option A, hot, sweaty, a temperature of 36.5 degrees Celsius and bradycardiac. Option B, temperature of 38.5 degrees Celsius, shivering, tachycardia and hypertensive. Option C, raised WBC, elevated blood glucose and temperature of 36.0 degrees Celsius. Option D, hypotensive, cold and clammy and bradycardic. Option B, that is, temperature of 38.5 degrees Celsius, shivering, tachycardia and hypertensive, is the right answer. Here we are at the last question, and I will surely be back with the next set of questions, so please stay tuned. 30th question is, which of the following techniques is advisable when obtaining a urine specimen in order to minimize the contamination of a specimen? Option A, clean around the urethral meatus prior to sample collection and get a midstream or clean catch urine specimen. Option B, clean around the urethral meatus prior to sample collection and collect the first portion of urine, as this is where the most bacteria will be. Option C, do not clean the urethral meatus as we want these bacteria to analyze as well. Option D, dip the urinalysis strip into the urine in a bedpan mixed with stool. So the right option is option A, that is, clean around the urethral meatus prior to sample collection and get a midstream or clean catch urine specimen. So that's it. So we'll be back with the next set of questions. Please study during this lockdown period, stay safe, and whoever are involved in the healthcare, please do take adequate care of yourselves. God bless you all.